I think scientists are actually very creative people, where the world and scientists maybe don't see it that way, but for scientists to come up with formulas and, I don't know, stats and things, there's a creative process that you have to follow. And I think there's almost like a symbiotic relationship without saying it maybe every day to each other as scientists and artists, but the one cannot be without the other. You know, you use color and pictures and lines and circles to formulate and to describe things so other people understand it, which are the same things that we use. We just use it in a different way. I had no idea what TB is really about. I didn't really understand the seriousness of TB before I was in the focus group.
I feel that this is empowering me as a person who has had TB to speak more about it. I still have friends and even a little bit of family that still don't quite understand the disease. And I think by creating, murals and involving art and stories, I think that it will come across to the layman easier.
That definitely gave me a better perspective and a better understanding of really what people are going through. And I mean, yeah, I really found it very insightful, I want to say.
So the background is blue, and the blues don't have numbers, so you can choose whatever blue you want to paint the background square.
We're at the Adrianza Clinic. And we're here for the TB, the Heart of the Matter Community Engagement Initiative. So this initiative really aims to use art as a means of communication between artists, TB researchers, healthcare workers in the community. And this is done in commemoration of World TB Day. So it aims to create awareness and to also give support to those who've had TB and are undergoing the TB journey. So a picture speaks 1,000 words.
This area, it's very prevalent. There's a lot of even children and adults with TB, and it's because people are not completing their TB treatment and they reinfect each other. It can be because of socio-economic reasons. They maybe don't have food in the house and they feel they can't complete their treatment because there's no food. They can't drink the tablets on an empty stomach. And our clinicians are struggling with people not completing the treatment.
We need to have more social impact where we actually engage and co-create knowledge, and I think people were so excited because we weren't just coming in and giving our knowledge and going back like as if we were all knowing and they didn't know much. We came here to learn from them and gain their perspective, and I think the community respects that because they do have knowledge to share.
So the Paint by Numbers was definitely to be more of an interactive project with maybe the staff that works at the clinic, but specifically the patients. It gives them a sense of ownership to the space where they have to go to a lot.
I painted the wall today. Everyone who comes here, they will see I was painting the wall. And it was very excited, like especially for her now there. I painted her face. So it was just fun for me, really.
I think the big challenge for us as scientists is to get the messages across to the community about health-seeking behavior, about the importance of adherence to treatment regimens, etc. And as you can hear from my phrases now, these are not really words that will immediately be received well by the population. And scientists use language that is not that easily understandable. Artists, on the other hand, see things differently. and they say things differently, either with words or with pictures or with music or with drama. They just say things differently. And I think artists are actually trained to bring messages across, where scientists are only recently really prompted to spend more time on bringing messages across that help to improve the health of the nation.